Every shot a hen, agus tagan se sin an teachta Bríd Smith.
Minister, on this really historical day, and I know most of us in this House are really happy and voted by 10 to 1 to push the bill for a termination of pregnancy forward, but my question is concerning the level of GP care that's available in this country. At the moment it's in crisis. How will it be affected when women want to access termination services in January, and what plans you make to improve the level of GP care in this country?
Sure.
Well, thank you, Deputy Smith, for the question. As the Deputy will be aware, preparations for the implementation of the termination of pregnancy services are at an advanced stage. I welcome the fact that this House passed second stage legislation. Passing the legislation is obviously crucial, but not only that, passing the legislation and making sure that we have the services ready to be operationalised as well. It is envisaged, as the Deputy knows, that most terminations up to 9 weeks of pregnancy will take place in the community setting. A number of medical practitioners have expressed an interest in providing termination of pregnancy services. You would have heard that from the ICGP when they would have given evidence at the special committee on this. Officials in my department and the HSE are drafting contractual proposals for the provision of these services. It is intended that this contract will be available to qualified medical practitioners who wish to provide the services, as well as to organisations that provide women's health services. It is vital that a safe, accessible, woman-centred termination of pregnancy service will be in place by January 2019, and we have provided additional resources in the very recent budget to ensure that we can do so. More generally, engagement is due to recommence tomorrow with GP representatives on a package of measures, including service improvements and reform to the GMS contract. I want to recognise on the floor of this House that GPs, like so many people, suffered additional burdens and costs during the financial recession. I wanted to move to a situation where they find their own career, their own operation in their community to be much more sustainable. I have reached agreement with the Minister for Public Expenditure and Reform to see a multi-annual investment programme in general practice, and I'm delighted that the IMO will be back in my department in trying to make progress on this. We've set a deadline by the end of the year in terms of trying to make progress on this. That's obviously in relation to your broader point about the sustainability of general practice as we ask it to take on new services. But specifically in relation to the termination of services, my department and the HSE are drafting contractual proposals for the provision of these services. We will resource general practice to provide these services. And I do think it's important, and I said this consistently during the referendum, and I said it because I believe it. I do not believe that this is something that will overwhelm in any way the Irish Health Service. It's not often an issue that gets raised in the context of other conditions and other patients seeing their doctor.
Have a better handle on the numbers, etc., but they are quite alarming, because the average across the OECD of doctors per patient, per 1,000 patients, is 3.3. In Ireland we have 2.7. Now, unless those figures are going to rapidly change, I think it will require, particularly in pockets where the numbers of GPs seeing more patients than others, like the North Inner City apparently has the highest level of patients to doctors in the country at 1,218 patients per GP. The next in line is a rural area, Laois Offaly, with 1,176 patients per GP. So you could actually have, if you combine that with imposing a 3-day wait, with the possibility of doctors saying, I'm opting out or I conscientiously object, you could actually have flashpoints where this becomes a real problem for accessing the services to terminate pregnancies. But I think we also do need in general to look very seriously at the level of GP care across the country that needs to be addressed. So, for example, there's an alarming 31% of GPs who are currently working are due to retire from the profession in the next 5 years, and how we're going to replace that level of care in a timely fashion.
Thank you, Deputy Smith. So we are providing for extra GP training places, but it's not good enough to just train more GPs. We have to work away to make sure we can ensure that general practice now and into the future is a sustainable career prospect for people studying to be a GP. That's why not only are we going to provide the extra training places, we're also providing a programme of investment. That's why those talks on that general programme of investment is taking place tomorrow with the IMO. And the IMO has asked that we set a deadline at the end of the year to try and resolve that and have in place a multi-annual programme of investment for general practice, because I do accept that over successive governments during the economic recession, general practice did take a hit in that regard. Above and beyond that, we will provide, and we are providing, and you saw this in the budget, specific resources in relation to the termination of pregnancy. And one of the things that I did hear from GPs very clearly, I've heard it as I've interacted with the medical colleges, and as you know, I've appointed Dr. Boylan to work with the HSE to make sure these services are ready, was that they wanted to know that there'd be an out-of-hours telephone service medically operated as well. That's an extra support for women, but it's also an extra support for doctors, and I have directed that the HSE have that service in place for January also.
Bríd Smith.
Obviously, Minister, we'll get our chance to put in amendments to the legislation, but I do think there's genuine problems in having forcing women to have a 3-day wait. You know, by the time they visit the doctor once, visit the doctor twice, and particularly in the flashpoint areas like parts of rural Ireland and the poorer parts of the inner city, where the level, as I said already, of GPs to doctors is much higher ratio. But there's an interesting article in the Times today on the question of conscientious objection. But one of the things the writer points out is that you may find doctors will object to buying into the service not because they have a problem with dealing with terminations, but because they have a problem with a work payment situation. FEMPI and the implementation of SAME saw a cut of 25% to income for doctors, and it hasn't been reversed. So there are numerous problems that have to be dealt with. But my fear here is that having one repeal, having one access to termination, the women and the pregnant people of this country will find themselves with a real problem of being able to access the GPs to deliver that service, and as I say, particularly those in the more vulnerable areas of isolated parts of rural Ireland or the poorer parts of the inner city.
Minister.
In relation to the issue of FEMPI or cuts or investment in general practice, I think I've addressed that by outlining to you the process that we intend to undertake, and there's further engagement with the IMO on that tomorrow. In relation to how the service will operationalise in 3-day periods, I'll save my comments. I think for committee stage where we'll have a lot of an opportunity to engage on that. But my basic premise in approaching this debate is what I said I was going to do during the referendum, I intend to do. We asked the Irish people to vote yes. We published a draft general scheme. That draft general scheme was debated up and down the length and breadth of the country, and I feel, regardless of my own personal views, a responsibility and a duty, I suppose, to move ahead with legislation that's very closely aligned from a policy perspective to what we said we would do during the referendum campaign. Look, in relation to the issue of numbers, and I accept on the issue of termination, you and I are largely on the same page. But I do often hear from people who aren't, or on a different side of this debate, a concern raised in relation to not enough GPs being willing to provide this, or the number of women overwhelming, or awful phrases like that, the service. I don't think that's the evidence. And we saw during the referendum campaign so many doctors put their names forward saying they were willing to provide it. And we did hear from the Irish College of General Practitioners at the special committee in relation to this. So I am confident that we can make progress in this matter.
Now, Deputy John Corran, please accept question 72.